5 health screenings seniors should skip after 70. There's a hidden danger in some routine tests that most seniors will never hear about. Every year, millions of older adults schedule checkups, believing they're protecting their health. But the shocking reality? Certain tests your doctor recommends might actually increase your risk of surgery, stroke, or even cancer. Recent research shows that up to 37% of medical screenings in seniors lead to unnecessary treatments, complications, or long-term side effects. And nearly 99% of people over 70 don't realize they're being over-tested. The top test on our list is responsible for 5% of all cancer cases in the U.S., on par with the risk of daily alcohol consumption. This is not something you'll hear in a clinic or see advertised, but the science is clear. Today, we're revealing all 5 checkups seniors should avoid and the shocking ways they can harm your body. You'll definitely be surprised by what ranks number 2. Before we dive in, comment below. Where are you watching from? How old are you? And have you ever regretted a medical test or procedure? Do you feel seniors are over-tested? We read every comment and reply with personalized advice. Like this video and subscribe for more essential health tips. Let's start with the first test, seemingly harmless, but potentially life-changing. Number 5. Bone density scan. At first glance, a bone density scan seems completely harmless. No pain, no needles, just a quick test to see if your bones are at risk for fractures. But here's what few people tell you. After age 70, a DEXA scan can sometimes do more harm than good. This scan measures bone strength and is mainly used to detect osteoporosis. Yet in older adults, particularly women, results almost always show lower bone density, even when there's no real danger. Bone loss is a normal part of aging, just like wrinkles or gray hair. Despite this, many seniors are pushed to take medications like bisphosphonates, which are meant to strengthen bones but carry serious side effects, including jaw necrosis and esophageal irritation. Research shows that treating mild bone loss in those over 70 has minimal impact on actual fracture rates. One study in the Journal of the American Geriatric Society followed 200+ women over 70 and found bisphosphonates reduced fractures by only 0.3% over 5 years. Meanwhile, side effects such as digestive problems, esophagus inflammation, and unusual fractures were far more common. Take Rose, a 76-year-old retired piano teacher. Her DEXA scan revealed mild osteopenia, even though she walked daily and had never fallen. Her doctor prescribed a bisphosphonate. Within 3 months, she developed severe reflux and jaw pain, unable to play piano for weeks. After switching to a regimen of vitamin D, weight-bearing exercises, and a calcium-rich diet, think sardines and leafy greens, she regained her strength and balance and had no fractures over the next year. A quick scan may seem wise, but for seniors without falls or fractures, lifestyle changes are far more effective. Strength training, balance exercises, proper nutrition, and correcting vitamin D deficiencies can reduce fracture risk by over 20%, according to a 2022 Osteoporosis International study. Don't let a number on a screen push you into unnecessary treatment. And now, one scan is even more dangerous. It can lead straight to brain surgery. Let's talk about that next. Number 4. Brain MRI for memory concerns. When seniors notice forgetfulness or confusion, fear often follows fear of dementia or Alzheimer's. Doctors frequently respond by ordering a brain MRI. But here's the uncomfortable truth. MRIs, which provide detailed images of brain structure, rarely answer the questions seniors hope they will. In most adults over 70, MRIs show normal age-related changes, slight shrinkage, or small white matter spots that are harmless. Yet once these are seen, they can trigger a cascade of worry, additional tests, and even surgeries that may not improve memory and could make things worse. A 2021 study in Neurology Today reviewed over 30 MRIs of patients aged 70-85 with mild cognitive complaints. While 86% showed some abnormality, Only 3% were linked to a treatable condition. That means 97% experienced anxiety over problems that weren't truly concerning. Nearly 12% were referred for invasive procedures, including spinal taps or biopsies based on ambiguous findings. Take George, a 74-year-old retired engineer. He occasionally misplaced keys or forgot names. His MRI revealed white matter changes, causing him to panic. He stopped driving and attending church, and anxiety worsened. When we reassessed him with a simple cognitive test, he scored well within normal limits. By focusing on sleep, hydration, and brain exercises, his memory stabilized in 3 months, and he regained confidence. Unless severe neurological symptoms appear like seizures, sudden personality changes, or rapid functional decline, MRIs are rarely useful for mild memory loss. A cognitive screening test is a safer, cheaper, and effective first step. Now, get ready. The next test on our list is one most seniors have already had multiple times, and it's number 3 for a reason. Number 3, cardiac stress test. For seniors experiencing mild fatigue, chest tightness, or just feeling off, the cardiac stress test often seems like the natural next step. This test monitors your heart while you walk on a treadmill or with medication that mimics exercise to detect blocked arteries. But after age 70, stress tests can do more harm than good, especially for those without clear signs of heart disease. False positives are common. Studies show that up to 40% of seniors over 70 receive abnormal results even when there's no real problem. This can trigger follow-up procedures like angiograms, stent placements, or bypass surgery, none of which improve survival or quality of life for patients without true cardiac issues. Instead, they often cause complications, including bleeding, kidney injury from contrast dyes, and prolonged hospital stays. Take Raymond, a 75-year-old retired postman who stayed active by walking daily. During a checkup, he mentioned occasional fatigue on hills. His doctor ordered a stress test just to be safe. The results were inconclusive, leading to a catheterization and stent placement. That night, Raymond developed kidney problems from the contrast dye and spent 6 days in the hospital. His fatigue never improved because there was no heart problem. He simply needed more hydration and rest. For those over 70 without classic heart symptoms, like chest pain during activity, shortness of breath with exertion, or a dramatic drop in energy, a stress test can do more harm than good. Safer alternatives include a resting EKG to check heart rhythm, or a coronary calcium scan to detect plaque buildup. These options are simpler, less risky, and far less likely to lead to unnecessary procedures. Number 2, colonoscopy. You might be surprised, but colonoscopies are not always a safe choice after 70, and they're rarely recommended after 75, unless there are specific symptoms. The procedure involves a long camera to examine the colon, but the risks increase with age. The preparation is harsh, requiring strong laxatives that can cause dehydration, dizziness, or kidney problems. Sedation adds extra risk for brain function in older adults, and the procedure itself can lead to complications like bleeding, tears, or heart rhythm disturbances. A 2019 study in JAMA Internal Medicine followed 1.3 million Medicare patients over 70. For every 10 colonoscopies in patients over 75, only 2 lives were saved, while more than 20 experienced serious complications, a 10:1 risk-to-benefit ratio. Even when polyps are found, many are slow-growing, and removing them can sometimes do more harm than leaving them alone. Take Dana, a 73-year-old grandmother and bakery owner. She had no symptoms, no family history, and 2 prior clean colonoscopies. Yet her new doctor recommended a screening. During the procedure, a small polyp was removed. That night, Dana fainted from severe abdominal pain and was found to have a bowel perforation. She spent 9 days in the hospital, lost 10 pounds, and hasn't fully recovered. Current guidelines from the U.S. Preventive Services Task Force suggest stopping routine colon cancer screening at 75 for most adults. For healthy seniors, non-invasive options like the FIT stool test are safer. They require no prep, no sedation, and still detect most concerning cases. Ask your doctor about alternatives before entering the colonoscopy pipeline. And now, we're at number 1. The most overused, most dangerous, and most harmful checkup for seniors. One you've probably already had. Number 1. Annual full-body CT scans. Full-body CT scans are often marketed as a way to catch cancer early, sometimes offered through executive health packages or private clinics. But here's the shocking truth. These scans expose your body to high doses of ionizing radiation. And for adults over 70, the risk of unnecessary follow-ups, biopsies, and even surgery is extremely high. Yet, there is no evidence that full-body scans without symptoms actually save lives. Each scan delivers 10-20 millisieverts of radiation equivalent to roughly 500 chest X-rays. A 2023 modeling study in JAMA Internal Medicine suggests that the increase in CT scans in the U.S. may now account for up to 5% of all cancers, on par with alcohol. 1 in 20 cancers could be triggered by a scan intended to prevent disease. CT scans often detect harmless nodules, cysts, or calcifications. But once these appear on the screen, a cascade begins. More scans, biopsies, and anxiety. Marcus, an 80-year-old martial arts instructor, experienced this firsthand. His full-body scan revealed a tiny 3 mm nodule. He underwent a PET scan and needle biopsy. The result was benign, but the biopsy collapsed part of his lung. Marcus spent 2 months recovering, all for something harmless. Experts now warn against full-body CT scans in asymptomatic adults. The American College of Radiology is clear. These scans have no proven benefit and significant potential for harm. Targeted imaging makes sense only if symptoms like unexplained weight loss, blood in sputum, or visible swelling appear. Otherwise, scanning the entire body is like using a landmine detector in a playground. You may find something, but the damage could be worse than the problem you were trying to avoid. A smarter, safer approach is listening to your body, maintaining regular checkups with your primary doctor, and only doing tests that are truly necessary. Your health, time, and peace of mind are too valuable to risk on fear-driven screening. So there you have it, 5 medical checkups that may seem helpful but can actually cause harm, especially after age 70. Modern medicine is incredibly powerful, yet it's not flawless. Sometimes, doing less is the smarter choice. Always ask yourself, what happens next? If a test finds something, if the results are uncertain, or if the risks outweigh the benefits, it may be worth pausing. Remember, true prevention starts with lifestyle. Stay active. Eat nutrient-rich foods, get quality sleep, and be selective about which checkups you undergo. We want to hear from you. Have you or a loved one ever experienced complications from a medical test or treatment that turned out to be unnecessary? What happened? Share your stories and thoughts in the comments below. We're eager to hear them. Thank you for watching.